On February 17th, Valemount hosted the bi-monthly meeting of the Northern Health Authority Board of Directors at the Best Western Inn and Suites. The theme of the meeting, chaired by Dr. Charles Jago, was continuous improvement in healthcare. The board was updated on a number of topics, including the patient simulation program, critical care, surgical services, and staff recruitment initiatives. The highlight of the meeting was an excellent presentation by Debbie Strang, Northern Health Services Administrator, and Valemount physician Dr. Stefan DuToit on the Valemount Walks Around the World program. Strang outlined the very successful program, informing board members that 10% of Valemount residents have enrolled and almost reached their initial goal of walking once around the world in just the first year, which was scheduled to take 5 years.
We created a world map that's in the community. It's in the local park, and so we can track on there so people in the community can see how far they're going without looking at the website. The walk is new, the Bigfoot walking trail, so it's getting that awareness out there that is available for them. It is maintained, and they want it peer-driven. Village of Valemount Councillor Hollie Blanchette, a driver and key proponent of Valemount Walks Around the World, also spoke about the reasons for the program's success.
It's all the little things that add up, and the village has been a big support, you know. We're all active. So it's about the community, and this community, like I said, is huge on Facebook, so we publicize a lot of stuff, what's going on, where to go, who to talk to. It's just get everybody out there, and everybody's connected here, so we all just work together.
The ideal team is bringing together a Northern Health person with a community person, and if there's icing on the cake, it's having physician involvement. And you guys have done it. You've brought together those elements that make this not only important for the 10% of the people who are out there walking, but for those 10%, there's another 10 or 20 or 30 who are watching and listening and having their consciousness raised about the importance of exercise and health is really powerful.
I think there's a lot of things that you've done right that we can learn from. And I'd like to really commend you folks for what you've done as a health team and as a community. I think this is a really good example of, and we can learn a lot of lessons from this for other communities.
We often start new projects which has no eventual change in outcome in the health of the community. So we have to make sure that whatever we do is measurable and that we actually do improve the health of the community.
How many kilometers has the group walked so far?
We're over 36,000 kilometers as a group, so we'd have to calculate individually how that looks, but as a group we're 36,000.
And what was the original goal?
To get around the world, I believe, is roughly 46,000 kilometers.
So you're almost around the world in, how long have you been going so far?
Almost a year. May 4th will be a year.
Oh, that's incredible. And the original projection was for 5 years.
Mm-hmm. It is. We have to remember that that's as a group. So each one of us, I mean, I've walked just over 2.5 million steps. And as a group, we've walked 37,000 kilometers. So there goes the math process. Yeah.
But no matter how you say it, it's been a tremendous success. Would you agree?
Oh, it is. And now we've started our winter walk, which we have a whole new bunch of people that are walking inside. And that walk is the Walk to Kamloops for Coffee.
Wow. And it seemed like during the board meeting there were a lot of positive comments from the board members and a lot of congratulations going around. Do you think this is something that other communities are going to embrace?
I hope so, because it's something that's very easy to do for everybody, and it's free to do it, right? You just walk outside your door.
So if you've gotten to this long distance in such a short time, are you going to revise the goal?
I guess we'll have to climb Everest next.
And maybe challenge another community would be great fun. We think this is a project that can keep growing. We don't have to stop when we reach the initial goals. So I would like to see us challenge a like-sized community to get walking as well.
We can also do challenging businesses against businesses as well, too, right? Yeah. So it's another option.
Okay, so we're now on Bell across Canada, so this is a shout-out, a throwdown to communities across Canada to get involved. If they want to get involved in this program, what should they do? I mean, you obviously laid the groundwork here for it. Can they contact you and work with you guys?
Mm-hmm, yep. If you go on to, I guess the easiest thing would just be to email us. And that's hblanchette@valemount.ca.
Great.
And I'm Debbie.Strang at northernhealth.ca. So certainly we've developed the program, so we have lots of little tidbits and information to share if another community wants to get going with us.
And any last parting words for those people in Valemount who haven't embraced this concept yet?
Come to the library and see me. I have a package waiting for you.